Hey everyone, and welcome back to Sensory of Animal Assisted Services and Service Animals. I'm Ari and I use she and they pronouns. Now we are going to talk about literature support for therapy animals and service animals. Before we jump into the studies, I would like to again note that some of the literature we discuss uses terms and outcome measures that may be triggering or upsetting for autistic and other neurodivergent people. I want to again emphasize that the Deaf Autistic OT and I support neurodiversity affirming research and clinical practices. As I mentioned in the previous video, most current available research related to autism and neurodiversity is run and published by neurotypical people and is neither accepting of nor affirming of neurodiversity. Please keep this in mind as we go through these research studies today. In a 2015 single group non-randomized study, 70 parents of autistic children provided responses to the Social Skills Improvement System rating scale. 57 of these parents reported that their family owned some type of pet, and children of families with a pet dog responded to the companion animal bonding scale. This study found that children whose families owned a dog or dogs had greater mean scores for social skills compared to children whose families did not own a dog or dogs. Furthermore, children of families who own at least one dog reported stronger bonding with their respective dogs, per the companion animals bonding scale. The results of the study suggest that pet ownership may be associated with increased social skills in autistic children. In a two-group randomized study, children with physical and/or behavioral diagnoses each received a total of 10 occupational therapy sessions, including 2 sessions to assess baseline behavior, 4 sessions with a therapy dog present, and 4 sessions without a therapy dog present. Participants were randomly assigned to the order of the latter 8 sessions, with half of the participants having therapy dog sessions first and half the participants having therapy dog sessions second. Per the Behavioral Rating Inventory of Executive Function, or the BRIEF, this study found that the presence of a therapy dog positively affected participants' behavior during participants' occupational therapy sessions. In a recent cross-sectional comparative study, 18 families were assessed with 5 different outcome measures, including the Adaptive Behavior Analysis System, Social Responsiveness Scale, Autism Treatment Evaluation Checklist, Canadian Occupational Performance Measure, and the Autism Family Experience Questionnaire. 6 of the families in this study currently had an autism service dog placed with them, and the remaining 12 of the families were on the waiting list for an autism service dog. The results of this study found that autism assistance dogs may increase social behaviors, decreased ASD severity, and improve family well-being. Furthermore, there were increased positive outcomes for families that had been paired with their autism service dog for longer. As we consider the study, I would like to again state that the Deaf Autistic OT and I support neurodiversity affirming research and clinical practices. In this study that I just presented, the researchers discussed ASD severity. Ideally, neurodiversity affirming studies would not discuss autism in terms of severity, but would rather investigate factors such as the quality of life of the autistic person. Please join us on August 22nd for Sensory of Equine Assisted Services. If you have any questions, please post them in the comment section of this video.